I too would like to thank Senator Savino for her tireless efforts to bring this bill to the floor, and thank the advocates and family members for their calls and their letters and their visits to Albany. I can tell you that I have always viewed medical marijuana with a very jaundiced eye. As a matter of fact, a few years ago, as a member of the New York State Assembly, I voted against a more expansive version of this bill. When I came to the Senate, I was named chairman of the Alcoholism and Drug Abuse Committee, most recently the Heroin Task Force, and I actually opposed the original version of this piece of legislation, the Compassionate Care Act. But Diane and others, you've addressed some of my concerns. As you know, I wanted a highly regulated version of medical marijuana. In my mind, I think of two different versions. California, which in my mind is really a joke of a medical marijuana, it's legalization light, and more like New Jersey, which is more regulated. This version is much more like New Jersey, highly regulated. The other issue I had, as Diane knows, she and I have spoken about it, was smoking. I'm against smoking, obviously, and I can't remember the last time we know of a doctor who actually prescribed smoking as medicine, probably the 1940s, if not before. We do not have smoking in this piece of legislation. As far as regulation, I know I wish I had as much faith as some of my colleagues here in the federal regulators, the FDA. When I think of the FDA, I think of a federal bureaucracy that has not allowed drugs that have been used safely in Europe for decades to come to the United States, that have allowed toxic chemicals in our children's products and not acted on that for decades, but did act on Zohydro, a powerful opioid that their own experts, panel of experts, decided 11-2 against allowing this into the United States, and they reversed the decision of their own panel of experts and is going to allow Zohydro to come to this country. That's the drug to watch. We need to be careful of that. Again, last issue, which is not in the bill, but I believe will be covered in the regulations, and I urge the Governor's Department of Health to do so, is a measured or metered dose. The doctors need to know how much of this drug their patients are getting, whether it's effective, whether it needs to be increased or decreased. I urge that, and I again thank Diane for bringing truly medical marijuana to New York State.